Hello and welcome to Wellness Wednesdays. I'm Dr. Stephen Ramos, Associate Medical Director with HealthTexas Primary Care Doctors. And every week we're going to bring you a video with special guests discussing important health topics. So today I have a special guest, our President and CEO of HealthTexas Medical Group, Dr. Kristi Clark. And today we're going to be talking a lot about why it's important to have a primary care doctor and choosing a primary care doctor and what to look for. But Dr. Clark, first, if you want to just tell the audience a little bit about yourself and your practice here in San Antonio.
Certainly. Like you, I am a San Antonio native, born and raised in San Antonio. I've been practicing here in San Antonio for now probably about 23 years, and the vast majority with our medical group, HealthTexas Primary Care Doctors. Prior to that, I was in residency, and prior to that, and then also I practiced at the Nix for a while in downtown. Still have a lot of those patients as well. But I would say that as a San Antonian, the community we have here is very unique. And I think many of us, despite where we go and we train, we ultimately, a lot of us come back. It's a good city. It's a great place to raise kids. It's a big city, but yet a small city. And I think what's important about San Antonio also is from a medical standpoint, this is a wonderful environment for all kinds of medical care. Now, primary care is kind of really just primary. I mean, it's something that every person really needs to think about, having a primary care physician. And I think a lot of us, as we're younger, as we're training, we think about all kinds of, sometimes that might be considered more exciting, like, neurosurgery or surgery, et cetera. But I'm very proud to be an internist. I'm very proud to be a primary care doctor, to be my patient's go-to. I like to be their first call. I love to develop a relationship with patients. And overall, I think I provide them great benefit. And I think a good primary care doctor is second to none when a person really starts their healthcare journey, especially as they age.
Yeah, crucial. And, let's talk a little bit more about the specifics of maybe what you feel like you accomplish really well as a primary care doctor, but what are the characteristics and traits that someone should really look at when choosing a primary care doctor?
Well, I think as when you're looking for a primary care doctor, you want someone who's usually specialized in either family medicine or internal medicine. And what's important is you want to have a good rapport with the patient, with the doctor, with the nurse practitioner, with the physician assistant, with whoever's providing your care. Relationship is the key, because a lot of practicing medicine is an art. Many things, many conditions in medicine now are kind of rote, and you do the same thing over and over and over. But the real benefit to a patient lies if you can strike up a relationship that you trust your physician, that you likewise have mutual respect for each other as a physician to a patient, to where you present each other, okay, here's some options, and here's the pros of this, and here's the cons of it. But you want someone, if you're a patient, who's going to listen to you, and not who is going to say, here's what we're going to do, and throw out a bunch of medications to you or a list of specialists, but to really listen to you. And in this day and age, it's harder and harder to do that because doctors don't have a lot of time. And so you really want, I would say the most crucial thing a person should look for is trust in the relationship, that your provider is going to listen to you. That's the most important.
I think that's incredibly important, being able to, like you said, offer an opinion. So a lot of times it's not black and white where you have this problem and here's the treatment. There's no argument, and that's just what it is. A lot of it is kind of risk versus benefits, and sometimes not knowing what the next step is going to be. But if you have that faith in your doctor that they're taking care of you and making that right decision for you, it makes things a lot easier. And then you also mentioned something that I think is really important for a lot of people now, as far as that team aspect, and not only just having that faith in the doctor, but anyone who's helping them, whether it's the staff, their APCs and nurse practitioners, having that whole kind of team working for you for your health is really important.
Mm-hmm. The young lady or gentleman answering the phone is as important in getting the right messages, as important in as the provider who's providing your health care. It's all a team. And you made me think of something else, with COVID and all we've gone through over the past 18, 24 months, those folks who didn't have a primary care doctor, they kind of end up going to an urgent care or, this place or that. And in conditions that sometimes last a little bit longer than 2 or 3 days, you end up going back somewhere, you may be seeing a completely different person. Having a primary care doctor, I think for those of, like for example, people in our practice, even though COVID was new and what we were doing was new, they still had a home, if you will. They had a location, they had a place to come. Even though we were all kind of figuring this out as we went, they were able to call up on the phone and say, you know what, I see Dr. Ramos, I feel confident going there. I'm going to run over there, and he's going to check me out, and the team's going to check me out. I think that's important. So a lot of us may not find a primary doctor thinking, I'll just go somewhere when I get sick. But in medicine, as you well know, a lot of times a condition evolves, or a condition is not diagnosed and fixed in one simple visit. It may be a myriad of things you try. It may be something like a cough, and we may tell a patient, okay, let's do X, Y, Z first, and we hope it works, but we know that if it doesn't, we're going to see him again, and we're going to follow down that next part of the pathway, because that's how physicians, how we think. And so I think that relationship is important. Otherwise, you're kind of starting over all the time.
Yeah.
And I know we see a lot of patients that happens,
And that continuity and relationship over time, knowing maybe, I've had this problem a couple of years ago. Yeah, I remember that. We tried this, it didn't work, and it's now this again, and hey, we have an easy solution. And
patients love that.
And part of that is not getting kind of sucked into overutilization and excessive care for certain minor things that if, we had just been following along, maybe would not have been so extravagant, but because you're meeting someone new for the first time or another repeat doctor for the same issue, we're going to order all these scans and all this.
And you're worried you might never see them again.
And then we have all that other expenses and time and so forth. So having a primary care doctor, I agree, is just something that can really be a lot more efficient and definitely more beneficial for your health.
And I think it also goes to the relationship with the patient, because if you have a good relationship with the patient's going to trust you. And if your doctor says, hey, we're going to do this for your cough, but if it doesn't get better, you're going to come back and you're going to see me, and then we'll try something else. And I think patients appreciate knowing that there's a plan. I think showing a patient that you've got your thinking cap on, that you have a plan in mind. I think patients are willing to be much more compliant with therapy, and telling them expectations. Hey, this isn't going to happen. It's not going to cure your cough in 6 days, but we're going to do this over a period of 3 weeks, and you're going to come back and you're going to see me. And that's what I think you don't get from popping from urgent care to urgent care to urgent care, because all that's lost.
And so how about people that maybe are not sick, people that are feeling pretty good, maybe they don't have any medical issues, they're younger? Why do they need a primary care doctor?
I think just to establish care, I hate to say it, but think about these people who had no one when COVID came. Having a relationship would have been nice, having a place to call, having someone where, even if you are seen once every couple of years, but having somewhere, a home, kind of a place where your medical care is established, I cannot emphasize how important that is. You don't want to be rushed in at the last minute, especially if you're sick, or if something's going on that, you're just looking at the first person on the phone book who can see you. It's nice to have a relationship. It's nice to have someone who has got, even if it's just your old insurance or a driver's license on file, you've got to start. And I think most people feel comfortable with that.
And I think something we also learned from COVID and during that whole time is a lot of education. So new information is coming out, do this, don't do that, get this vaccine, take this medicine. Having a primary care doctor, even if you were never really sick, but you at least know somebody that you feel like you can trust to get that information, calling in, setting up an appointment to come in and say, hey, I heard this on the news. Should I be doing this, or what do you think? I think that's a really useful tool for a lot of people who maybe don't need to go to the doctor that often, but it's nice to have that opinion available to you if it ever comes up.
And also having a primary care doctor who's maybe in a large group, you also have the benefit of all of the experience of multiple partners, multiple locations. There's a lot of talented docs in this city. And there's a lot of docs been practicing for a long time, and who, there's a lot of, great medicine that was accomplished during COVID, and making sure that you're just not going to whoever's manning the doc in the box. It's a real privilege.
Yeah. So if someone is looking for a primary care doctor, where would you tell them to go?
Well, obviously I'm biased, and as president and CEO, I would say they should come to HealthTexas primary care doctors. I think location's important. Being close to your doctor is important. I've been practicing for a long time, and I have a lot of patients that travel from downtown. As they've gotten older, that becomes harder and harder. And so I think that location is important, whether it's close to your work, whether it's close to your home, but being able to where it's not a hassle. I think location is really important, and again, the relationship. I would say those are the two most important things. And obviously, I would use who's in your network. If you you don't want to go out of network, medical care gets costly. But relationship number one, and location and staying in network, can't go wrong.
And so with location and access to care being kind of two crucial things, we have 17 locations around San Antonio, hopefully growing soon to give more access to San Antonio. What else has HealthTexas done to provide more access to care to our patients? Maybe after hours, weekends, different locations if they are driving around.
I'm glad you asked that because also, as I mentioned earlier, I have patients who have traveled and followed me for different locations around town. What's nice is, they may see me always at the same location, but we have ancillary services. They may want to do their blood work at a location closer to their home or closer to work. That's very important. They may want to get echocardiogram somewhere else. They may want a Saturday appointment. We have two of our locations, the San Pedro and the Wurzbach location, that provide Saturday care. We have several of our offices which provide extended hours all the way up until 7 or 8 p.m. Sometimes I work one of the later clinics, and I rarely see patients of my own, but I see patients of our partners that, didn't want to take off work, that really wanted a 6 p.m. appointment. And the beauty is we have the medical record. I can not skip a beat. I can walk in there and I can see that, if it's your patient, everything that you've done previously, and I can just walk in there and just take up exactly where you left off, and hopefully the patient gets to come at a time that they want and leave with a continuity of care. And so I think that's also one of the benefits of going to a large medical group with multiple practices and multiple locations. You may be getting your primary care most of the time at one location, but you have options. And I think that we've changed a lot through the years in really trying to make all of our clinics accessible to whoever's around that area. So you may do your labs elsewhere.
Yeah, I think we have some of the best access in town, and really making it easy for our patients to get the care that they need, whether it's with me or somewhere else. And location, we have tons of those locations around town to allow for San Antonio to come in and be seen and establish with us and develop good relationships and hopefully keep everybody healthy.
And now virtually all of our clinics have very easy parking. We have almost all freestanding buildings, not a lot of parking issues, because that's a hassle too. And we're always kind of located on big thoroughfares, so it's quick, easy in and easy out. And lots of other providers, so you can get in for a quick appointment and usually be out 15, 20 minutes.
Yeah.
We've worked on that.
And then one thing I want to talk about just very briefly, and what your prediction is and maybe how we're going to utilize this in the future, but televisits. It's something I think that's new, that's available, that came out of COVID. It provides that extra level of access to our patients, and where do you see that going in the future?
I think televisits are great. I think there's a lot of future in televisits, especially, and not for everything, but as we know, many times, maybe your patient's following up to see if the blood pressure medicine worked. We don't really have to see the patient. We can talk to them on the phone. We can see them visually. They can tell us, hey, here's my readings, doc. I'm doing well. No side effects with the medications. And they've saved the time driving over there. They haven't taken a day off of work. Simple things like urinary tract infections. I think there's a lot of, I think follow-up is really the key. If you're following up a simple condition, maybe we've adjusted medications. Maybe we're reviewing labs, and I see you, once or twice a year, but we're going to do it 4 times a year. Maybe 2 of those are televisits. I think what doesn't work for televisits is if you have a new symptom or something that no one's seen before, your doctor is not familiar with it, haven't ever spoken with Dr. Ramos or Dr. Clark about a new rash. Sometimes that's hard over the telephone. And then, of course, a lot of elderly patients can have, even though their symptoms might sound relatively benign, we know they can get very sick very quickly. And so, again, having a relationship, your doctor knows, oh, that's Mrs. So-and-so. She tends to get pneumonia every time this part of the year comes around, and we might be wanting to bring that patient in. But I think there's a lot of room for televisits, especially for young, healthy patients who are doing a quick follow-up. They can do it on their lunch hour. They can do it after hours. It's easy, simple, and I think most of us, even physicians, we enjoy it as well.
Yeah. Provides a lot of efficiency. We can
Very efficient.
Be able to take care of patients pretty quickly.
And you can still get good quality care.
Yeah.
You don't always have to see, I think we get used to every time that the doctor sees you, they have to listen to your lungs and your heart. we know that's not really true. I mean, most of the times that's really not necessary.
Yeah, I think it's just part of moving with the times, and we'll see how more broadened that gets over the next couple of years. But that's great. So I think today we learned a lot of information about why you need a primary care doctor, how to find one, and what to look for next time you are shopping or if you are looking for a new primary care doctor. So Dr. Clark, thank you for all this wonderful information. And
thank you, Dr. Ramos.
Thank you guys for watching us, and tune in next week. Have a good day. Thank you for joining us for Wellness Wednesday. Again, I'm Dr. Stephen Ramos with HealthTexas Primary Care Doctors. If you have any questions or want to reach out to us, our phone number is 210-731-4800, or you can visit us on our website at healthtexas.org.